Hey, this is Arin, and you're watching Angle of Study Root of Success, the online career and education classes. In this masterclass, we're gonna talk about some important questions related to nursing officers exam. Okay, so before we begin, press the subscribe button and press bell icon right to next to it, and also give a thumbs up if you like our work. Question first है where the permanent pacemaker battery has been implanted. A. Below the right clavicle. B. Near the brachial artery. C. In the fifth intercostal area. D. In the midstream area. And right answer A. Below the right clavicle. SA node work as pacemaker. It also known as pulse regulation center. Right? A permanent pacemaker battery is usually implanted with the skin below the right clavicle. The wire for a temporary pacemaker is inserted through a peripheral vein, not the brachial artery. And patient feel dizziness during activity when pacemaker malfunctioning. Next question है a patient with suspected rheumatic fever is admitted to the pediatric unit. When obtaining the child history, the nurse considers which information to be most important. Vomiting for first day, recent episode of pharyngitis, a fever that started 4 days ago, and last, lack of interest in food. And right answer is a recent episode of pharyngitis. B. Recent episode of pharyngitis is the most important factor in establishing the diagnosis of rheumatic fever. Other findings are not specific to rheumatic fever. Next question है when a client develops ventricular fibrillation in a coronary care unit, what is the responsibility of the first person reaching the client? A. Administer oxygen. B. Initiate defibrillation. C. Initiate cardiopulmonary resuscitation. D. Administer sodium bicarbonate intravenous. And right answer is B. Initiate defibrillation. Ventricular fibrillation is a lethal dysrhythmia and once identified must be terminated immediately by defibrillation. So the sinus node can again act as the heart pacemaker. This is usually a standing order in a coronary care unit. Next है question. Which exam is most reliable in diagnosing peptic ulcer disease? Upper gastrointestinal X-ray, gastric analysis, endoscopy, barium studies. And right answer is C, endoscopy. All of these listed can be used to diagnose an ulcer, but endoscopic exam is the only way to obtain accurate visual evidence. Next question है the main principle of shock treatment is A. To increase the arterial pressure, B. To increase the peripheral vascular resistance, C. To increase the cardiac output, D. To improve the peripheral blood flow. And right answer is D. To improve the peripheral blood flow. Next question है stallworthy sign is seen in which disease condition? Vasa previa, abruptio placenta, placenta previa या cord prolapsed. Right answer है C, placenta previa. Next है the nurse is assessing a client after a car accident. Partial airway obstruction is suspected. Which clinical manifestation is a late sign of airway obstruction? Option है A. Rales oscillate in breath sound, B. Restlessness, C. Cyanotic ear lobe, D. Inspiratory stridor. And right answer is C. Cyanotic earlobe. Restlessness and inspiratory stridor are both earlier symptoms of obstruction, and cyanosis and loss of consciousness will occur later. Next है, which of the following is the first line drug used for pain management? A. Acetaminophen, B. Clonidine, C. Morphine, D. Tramadol. And right answer is A. Acetaminophen. Next है, a child with leukemia having nausea should be offered cold clear fluid, B. Warm clear fluid, C. Low protein diet, D. Low calorie diet. And right answer is A. Cold clear fluid. When playing with children, a toddler play can best be described as A. Parallel, B. Competitive, C. Cooperative, D. Sharing. And right answer is A. Parallel. Next question है, in majority of the case the causative organism for sore throat is A. Gonococci, B. Staphylococci, C. Meningococci, D. Streptococci. And right answer is D. Streptococci. Group A beta hemolytic streptococci is a common bacterial infection of the throat and the tonsil, especially in the children between the age of 5 and 15. Typically characterized by fever, sore throat and painful swelling. Next question है, doctor has advised the nurse to prepare the room for a patient with a spinal cord injury at C7 level. Which one of the following is most essential to be kept ready for this patient? A. The hollow breast device, B. Catheterization tray, C. Ventilator on standby, D. The spinal kinetic bed. And right answer is आंसर है keep a ventilator standby. Next question है, postural hypotension is A. Drop in systolic pressure less than 10 mmHg when patient change position from lying to sitting. B. Drop in systolic pressure greater than 10 mmHg when patient changes position from lying to sitting. C. Drop in diastolic pressure less than 10 mmHg when patient changes position from lying to sitting. And D है, drop in diastolic pressure greater than 10 mmHg when patient changes position from lying to sitting. And right answer is B. Drop in systolic pressure greater than 10 mmHg when patient changes position from lying to sitting. Orthostatic hypotension या postural hypotension means hypotension occurring when a person assumes an upright position after getting up from a bed or chair. It is mainly occurred due to dehydration and hypovolemia caused by side effect of antihypertensive medicines like loop diuretics. Next question है, the P wave on the electrocardiogram ECG corresponds to A. Arterial depolarization, B. Arterial repolarization, C. Ventricle depolarization, D. Ventricle repolarization. And right answer A. Arterial depolarization. Next question है, baroreceptors or presoreceptors are located at A. Wall of aortic arc, B. Carotid sinus, C. Vena cava in right atrium, D. Both A and B. And right answer is D. Both A and B. Baroreceptors are found in the wall of the carotid sinus and aortic arc. Next question है, which diagnostic test would confirm the diagnosis of Hawkins disease? A है presence of Epstein-Barr virus in the blood, B. increased VMI in urine, C. Presence of blast cells in the blood. D. Presence of red Sternberg cells in the lymph node. And right answer is D. Presence of red Sternberg cells in the lymph node. Presence of red Sternberg cells into lymph node is the classical hallmark of this disease. And what is Hawking disease? Hawking disease is a malignancy of lymph node. Next question है, what is the most common assessment finding in a child with ulcerative colitis? A. Abdominal distension. B. Anal fissure. C. Profuse diarrhea. D. Headache. And right answer is C. Profuse diarrhea. Next question है, who invented thermometer? A. Celsius. B. Galileo Galilei. C. Lord Kelvin. D. Thomas J. Manning. And right answer is Galileo. B. Galileo. Next question है, the nurse caring for a client with a head injury would recognize which assessment finding as the most indicative of increased ICP? A. Nausea and vomiting. B. Headache. C. Dizziness. D. Papilledema. Right answer is D. Papilledema. Next question है, spike and wave discharges in EEG record is typical of A. Parkinson disease. B. Alzheimer's disease. C. Delirium. D. Epilepsy. And right answer is D. Epilepsy. Next question है, the largest serous membrane is A. Pleura. B. Pericardium. C. Mesentery. D. Peritoneum. इसका राइट आंसर है D. Peritoneum. नेक्स्ट क्वेश्चन है, Alma Ata Declaration was made in A. 1948. B. 1958. C. 1968. D. 1978. And right answer is D. 1978. Next question है, a person was found dead with bluish green frothy discharge at the angle of mouth and nostril. What is the diagnosis? A. Arsenic poisoning. B. Copper poisoning. C. Mercury poisoning. D. Lead poisoning. And right answer is B. Copper poisoning. Next है, intermediate syndrome is observed in A. Cardiac arrest. B. Respiratory failure. C. Renal failure. D. Organophosphorus poisoning. And right answer is D. Organophosphorus poisoning. Next question है, surgery done for myasthenia gravis is A. Thymectomy. B. Symplectomy. C. Meniscectomy. D. Mastectomy. And right answer is A. Thymectomy. Next है, which of the following common in mania? A. Flight of ideas. B. Echolalia. C. Neologism. D. Clank associations. Right answer है A. Flight of ideas. Next question है, when nurse providing information about iron supplements, which instruction by the nurse is most appropriate? A. Take the supplements with meal. Be aware that iron can cause abdominal pain. C. Make sure you drink plenty of fluid. D. Both A and C. And right answer is D. Both A and C. A client receiving iron supplements may complain of constipation. The nurse should encourage the client to increase fiber diet and fluid to help prevent or control this problem. And iron supplements are best absorbed when taken between meals. Next question है, what recommendation by the nurse is most likely to be effective in helping the client control bulimia? A. Take a daily inventory of food offered at the dormitory. B. Avoid eating in fast food establishments. C. Keep a daily calorie count of all foods consumed. D. Restrict using the bathroom after meals. And right answer is D. Restrict using the bathroom after meals. And last question is, to calculate cardiac output, heart rate is multiplied with A. Stroke volume, B. Systematic arterial pressure, C. Pulmonary arterial pressure, D. Circulatory volume. And right answer is A. Stroke volume. Okay friends, eat well, keep your mind peaceful, stress free, and wish you all the best for your exams coming up. I know you're gonna rock them. So keep watching and also subscribe to the channel. Give me a big thumbs up if you like this video, and happy watching.